Happy to. Pleasure to see you all today, and thank you for making it out here. Just a little quickly on myself. I'm a healthcare investor at General Catalyst. To give you an overview of our company, we've been investing for 20 years, but really doubled down in healthcare over the past kind of 5 to 10 years. And to give you a sense of who we partner and invest with, right? We're a supporter of companies like Devoted Health, Cityblock Health, Maven, Sword, just to name a few of a couple of the platforms in the services space. And then myself, I spend a majority of my time looking at all things in the services sector. So name it, all things value-based care, right? All things around shifting the site of care to where it's more convenient for patients, and all things underneath that as well. And so excited to be in front of you all and talk about some of the trends we're seeing in the space today.
Wonderful. It's a pleasure to have you here, and I'm sure a lot of the founders that we work with at all levels, since we work with early stage, Series A and beyond as well, are definitely excited to hear about what you have to say. For those at the early stage, it would be great to know sort of what is the next arc of value-based care.
Yeah, absolutely. I think when thinking about this question, right, it's actually important to take a step back and look at what's actually happened over the past 5 to 10 years. So if you look in value-based care, right, I would say really where the success of platforms has been primarily in the primary care space, right? So you've seen provider organizations like Village Health and Summit Health succeed, right? You've seen advanced primary care centers like Oak Street and ChenMed also see successful exits, or even enablement technologies or MSOs like Agilon and Aledade do pretty well. And I think if you really extract what the playbook was, right, there's probably 3 key drivers. One was aggregating physician and kind of patient supply to go then negotiate contracts with payers. 2 was to increase revenue through risk adjustment, and 3 was to kind of, at the end of the day, drive down medical cost spend. I'm not going to comment particularly on my view on risk adjustment specifically, right, but there's certainly been a lot of regulatory scrutiny, as well as just public scrutiny in general around risk adjustment. So I think gaming or focusing heavily on that lever going forward is probably going to be called into question. And I think actually where there should be predominantly focused on over the next couple of years is around the medical cost trend, right? And so taking that a step further, I think one of our core theses, thinking about the next couple of years for early stage opportunities, is saying, okay, to really truly manage the medical cost spend, you have to manage specialty, complex chronic specialties in a much better fashion, right? And so our thesis is, okay, looking ahead at what happened in kidney care, you need to have specialists act as actually the principal care coordinator for these complex high-cost specialties. And so we see opportunity across specialties like cardiology, oncology, obesity medicine, and still kidney care, right? And so we're pretty excited about that piece. The second piece I would say is there's actually a lot of opportunity still in outpatient kind of non-emergent elective specialty care as well, right? And so if you think about specialties like orthopedics, bariatric surgery, interventional cardiology, right, there's opportunity to, one, really move the site of care away from high-cost sites of care like the hospital inpatient or hospital outpatient setting to a place that's honestly more convenient for patients at a significantly lower cost. And then even again, taking that a step further, you should think about what is the way we can reduce unnecessary utilization. There's a lot of ways to manage things medically, right, versus immediately proceeding towards a surgery. And so forcing physicians and providers and patients to think critically about that choice will be pretty crucial going forward. And then the last thing I would say, right, is this is very much focused on a care delivery setting. There's also, I think, a large set of enabling technologies, right, that can really transform the way value-based care is delivered, but perhaps I'll pause there for now.
No, sure, of course. I mean, it's been also a pretty tumultuous and it's been a pretty scary year for some of the founders in 2023, given some of the, financial incidents that have occurred, especially in the earlier part of the year. A lot of folks that are founders in the startup area are a bit daunted about what's coming in 24. What should they focus on in terms of looking to raise funds next year?
Yeah, absolutely. So I think even honestly, not just this year, but if you rewind the clock 18 months, right, it's been a particularly tough fundraising environment, which I'm sure every founder here would tell me. I think I don't have a crystal ball to say, right? But I would say that our general sentiment is that it's going to continue for the next 12 months, right? That being said, one caveat is that we've certainly seen inflationary pressures have started to cool in the public markets. We've seen the first quarter of really strong GDP growth, right? And so the general sentiment is rates will start to cool off. That being said, I think as a founder, your number 1 and number 2 priorities in healthcare, right, is 1, keep the lights on and make sure the company's still running, and then 2, as a result of that, make sure you're always able to deliver the necessary patient care, even in downside scenarios, right? So keeping that in mind, I think you really have to think about, like, okay, which milestones do I want to achieve by when? and really back solve aggressively towards that, right? So prioritize all of your time and resources there, not just capital, right, but your personal time as a management team, as well as your team underneath you. And then the last thing I'd probably call out is that, personally from my experience, right, we're seeing some fundraising process take 3 to 6 months, right, which is particularly long compared to the 2 to 4 weeks you might have seen in 2021. And so as you think about that, right, I would recommend actually going out to raise 9 to 12 months prior to your cash out date versus some more aggressive timelines. You never want to be in the position, right, where you're looking to close a fundraise maybe a week or two out from being cash out, because that just creates a lot of stress for not just you, but your entire team, as well as the patients and providers you're serving at the end of the day.
No, I think that's really sound advice, and hopefully that's taken on board. I know it's easier said than done, of course, but yeah, I think that's really some sage advice that I think a lot of the startups could use right now. I want to flip the conversation to going back to value-based care and looking at the role of technology around value-based care. What can you say sort of around that right now?
Yeah, I think that's a great question. I think the way I would think about it is actually splitting it out by the type of organization you are, right? So let's take one side, which is kind of care delivery. At the end of the day, the core drivers of any success in any value-based care delivery organization, right, is like, one, let's go out and manage and engage members, right? Two is let's actually organize providers and practice and kind of what our thesis of change is for a clinical and operating model. And then three is having technology that can really enable all of the above, right? Technology is not going to be the core driver of success in these clinical organizations, but is a critical enabler. And so as you think about that, right, technology can certainly be an enabler of things like screening and risk stratification, right? A lot of that can be automated at the end of the day based on different data feeds, whether they come from claims data feeds, EMR data feeds, et cetera, et cetera. I would say the second, right, is really think about how you can reduce provider burden. We all want providers to be practicing at the top of their license. We all want them to be doing what they love doing most, right, which is seeing patients, versus entering notes into an EMR or filling out forms, right? So thinking about ways to automate documentation, right, automate coding, et cetera, I think is going to be critical. And then the next thing I would probably call out, right, is really thinking if you need a tight operating model, how do you actually track all these metrics? How do you report them out? And how do you tightly manage to them is another key place where technology can play. Now, if you think about non-care delivery organizations, right, we at GC see opportunity in particularly two areas in value-based care, right? Any founder that's sitting here today that's negotiated a value-based care contract with a payer can tell you that that process is arduous. It takes about 3 to 6 months plus. And a large place where people get stuck is, frankly, negotiating and going back and forth with the actuarial teams, right, and doing the actual analysis there. And so we, frankly, see an opportunity for a platform to exist as a source of truth, right, where it's the consensus of actuarial analysis as an intermediary between value-based care organizations and payers and providers even, and say, okay, this is not just a system of record for where contracts are structured or where analysis is conducted, but it can also serve as a system where, at the end of the day, you're actually essentially continuously assessing the performance of your contracts and also making payments potentially down the road. And then the second technology I see that we see a lot of compelling opportunity in, frankly, is thinking about how we revise our view around how to forecast healthcare outcomes, right? If we think about the traditional way we forecast healthcare spend, it's really focused on near-term pressures, right? So like, okay, what is the next year's inflationary spend going to be across these different sites of care or different types of care, right? What are the new drugs that are coming onto the market? What are the drugs that are going to be generic, right? And based on that, you come to a view. But in our perspective, right, there's much more you could do with that. So for example, instead of saying, okay, how do we think about spend for next year, look at it at a patient and population level. Based on that patient's kind of underlying factors today, what's the probability distribution of the different clinical states they can end up in over the next year or two? And then based on that, let's design our clinical intervention programs to tightly manage those patients and how they can evolve. So I know I went on for a while, but those are a couple of the areas where we see technology playing a role.
No, that's great. I think they're definitely really good insights that everyone can take away from. But before I let you go, because I know we're a bit limited on time, just want to ask you one last question around what you guys do in terms of collaborating with different providers to make sure that the models are actually working.
Yeah, absolutely. So I think, again, in these value-based care delivery organizations, providers are the ones that are delivering a significant portion of the value at the end of the day, right? They're the ones actually managing these patients. They're the ones seeing what's happening on a day-to-day basis. And so from our perspective, I really want to be aligned with their incentives And if you really think about where providers sit in 2023, right, they're encountering a lot of burnout. And it's driven, in our opinion, by three key factors. One is that they're simply being forced to optimize for the reward function of number of patients per hour, right, due to the fee-for-service compensation world, where you're focused on RVUs. Two, there's a lot of workplace violence going on, right? And then three, there's a significant amount of admin burden. And so for us, we're particularly focused on models and solutions that can address all of those three. Our core thesis, right, is obviously, I think, value-based care flips the mindset around solving for a number of patients per hour as the core reward function, instead spending the appropriate time with patients, right? So that way they're receiving all the care they need. I think number two, right, is again, as I was mentioning in the role of technology, reducing all of that admin burden and enabling physicians to see patients much more is very critical. And so that's the way we think about delivering services to providers, right? I think the second thing is make sure your providers are actually part of your future strategy, right? So I think physicians love to engage, for example, around thinking about the future of the clinical model, the future of the clinical strategy, and having roundtables and medical directorship roles really helps them feel engaged. And I think tying that in with equity contribution as well is pretty critical, right? Making sure, for example, when you're going out and fundraising, right, you're actually reserving equity for your provider employees and not just management teams is another thing we keep in mind at the end of the day.
That's really, really awesome. Pranay, thank you so much for taking the time to come and speak with me today.